Okay. Well, hello everybody. I hope this turns out. I hope the recording comes off as should. I hope it's in focus. My son Joshua is the guy has always helped me produce my videos and my podcasts, and he has moved to Santa Barbara, and I'm an idiot when it comes to internet technology and cameras and video and everything else. So hopefully this turns out. If you're listening to it or viewing it, then obviously it turned out. But if the quality is not up to par, or if there's any problems with it, my apologies. Bear with me. So I wanted to talk to you today about symptoms and how most of us, how we deal with symptoms, how we view symptoms, and kind of how society has brainwashed us in how we approach dealing with symptoms. So symptoms simply are the way our body communicates with us. It's our body's way of letting us know that there's something wrong. Most common symptoms are obviously pain. So it could be a headache, it could be neck pain, low back pain, knee, shoulder, elbow, whatever. So musculoskeletal pain primarily is the most basic symptom that our body is trying to get our attention about. Those symptoms can also be things like dizziness or nausea or stomach pains, indigestion, blurry vision, all kinds of things. And I could go on and on, but the point I'm trying to make is there are some symptoms that are serious, and we really can't mess around with them, and we got to go get medical attention immediately. So obviously any kind of symptom that would be mimicking, say, a heart attack or a stroke or a severe infection, those types of symptoms are things that might or most likely require medical intervention, and you need to go to the emergency room and deal with that issue to get it under control. But I want to focus on more symptoms that are more common in our world, which are the ones I was kind of talking about earlier, which is, pain. So unfortunately, we live in a society that doesn't want to deal with pain, and we don't have time for pain, or we downplay the possible significance of the pain. And what I mean by that is, let's just use a common symptom of headache. They're really, really common, but common doesn't make them normal. So what I mean by that is, just because you get something, let's say, oftentimes I'll talk to a patient and I will say, do you get headaches? And they'll say, yeah, but not that often. I'll say, well, how often do you get them? Oh, once a week. So that's 4 a month. Well, I got news for you. That's too much. Okay, you shouldn't have headaches that often. But people accept it as normal. People accept a lot of aches and pains as normal. And oftentimes the way they deal with them is by just taking a Tylenol or an aspirin or any kind of over-the-counter NSAID, getting the symptoms under control or masking the symptoms, ignoring them, and then carrying on with their day and carrying on with their life. The same could be said for any types of pain, any types of musculoskeletal pain, joint pain, muscle pain. A lot of people just ignore it, or they have the mindset that it's normal, it's part of just getting older, or it's part of overdoing it, or whatever they tell themselves, and they just mask the pain and they go on. But that line of thinking will eventually catch up with you, and will eventually get you into a situation where things might get a lot worse than you originally thought they may be. So think of symptoms as sort of the warning light on the dashboard in your car. Anybody who takes care of their car and pays attention to whether it needs maintenance or whether it needs a mechanic to look at it. When the warning light goes on, you don't ignore it. You don't just snip the wire to the warning light so that it doesn't keep telling you there's a problem. You take it in and you find out what's creating the warning light to go on, and you fix the problem. Our bodies are very similar. I know that's a kind of a simplistic analogy, but it's the same thing. When you have pain, that's your warning light going on. And if you just pop a pill to deal with the pain, it's no different than clipping that wire that goes to that warning light in your car. It's not the right thing to do. And if you did that in a car and you just ignored it, eventually the problem that is occurring in your car is going to get worse. And, it might have been a real simple fix initially, but if you wait too long, you might be looking at, thousands, if not tens of thousands of dollars of money spent to repair your car. Well, our bodies are the same way, okay? It might be cheap and easy and convenient to just take that Tylenol, but if you keep doing that and the symptom, let's say that your headaches are coming from your neck, which 70% of headaches are what they call cervicogenic, or they do come from the neck. If you just keep taking that Tylenol and you kind of mask the pain and you keep it at bay, and it's coming from your neck, and your neck's getting worse and worse, you're eventually going to possibly develop osteoarthritis or degenerative arthritis, or maybe you're developing a bulging disc, or you're getting pressure on a nerve root. It's called stenosis in the neck. Those kinds of things. If that's what you're hiding or masking with NSAIDs as time goes on, well, it will eventually get to a point where the pain is so intense that the Tylenol is not working anymore. Some people will move on to stronger and stronger things, go to the doc, get a prescription pain med. But eventually, if that is the underlying problem, it's going to get worse and worse and worse if they don't deal with it. And it's going to get so bad that for some people, unfortunately, it might result in them having to get surgery. And in that case, their neck will never be the same. And that's a very unfortunate road to go down, when if you would have just paid attention when it started off and done something about it, like maybe go to a chiropractor and get the underlying problem in the neck corrected before it gets worse, then you've really saved yourself some money and fixed the problem in a real simple manner before it got worse. So that's just one example. That same example could be applied to all kinds of musculoskeletal pains that we see: low back pain, knee pain, shoulder pain, hip pain. Many of these pains are caused by imbalances, and my job as a chiropractor, or any chiropractor's job, is to evaluate a patient and determine those underlying imbalances, whether they be structural or muscular. Structural means it's related to misalignments of the joints or the bones in your body, and muscular is relating to the length tension relationships and overall balance of the what are called agonist and antagonist groups of muscles in your body. So my job is to assess all those things and get the body back in balance. And if you get the body back in balance, the symptoms go away. So when you talk about holistic health, which is what chiropractic is really preaching, we want to look at the body structurally, chemically, and psychologically. So we also want to look at the balance of your diet. We also want to look at the balance of just your life in general. Are you eating the way you should? Are you exercising the way you should? Or are you exercising at all? Or maybe you're exercising too much and you're overdoing it. All these things are things that can be out of balance in a patient's life. Maybe they have a tremendous amount of psychological stress and they just need some advice and some strategies on how to restore balance in that aspect of their lives. So any good holistic practitioner, whether they be a chiropractor or a naturopath or whoever, is somebody who's going to help a patient first realize that symptoms aren't normal. They may be common, but they're not normal. And they're going to try and get to the base cause of the problem. So, I think that the reason I got to thinking about this and the reason I bring it up is too many patients that I see, when I ask them about their health issues, they kind of undermine these types of things. So, they may be coming in for back pain, but then they also take, an antacid, and they, take NSAIDs on a regular basis, and maybe they take a blood pressure med and a cholesterol lowering med, and they just think that, well, I take all these medications, so I'm fine. What they don't really realize is all they're doing is masking symptoms. They're taking an antacid to mask indigestion. They're taking a heart medicine just to keep their blood pressure under control, when high blood pressure is really a symptom. And it's your body, once again, telling you that you got to clean up your diet, get your weight under control, and start exercising. High blood pressure is a really easy problem to prevent. So, I don't want to ramble on, but I just want to make the point that you need to pay attention to what your body is telling you. It's really a gift, if you want to think of it that way. If you learn to listen to it and you take control of your health, you can really live a healthy, productive life, free of pain and free of disease, just by listening to your body and doing what's necessary to get it back in balance. And unfortunately, too many people in our society don't listen to their bodies, and they really end up paying the consequences of not listening to it. So I hope that makes sense to whoever's listening to this or watching this, and I hope that I basically leave you with some inspiration on taking control of your health, learning to read your body, learning to listen to your body, and use those signs and symptoms as a way to get your health in balance and get your life in balance, so that you can lead a happy, healthy, productive life, free of pain and free of disease. And living that way is a beautiful thing, and it certainly beats living a life full of pain, misery, and dysfunction. So I thank you for listening, and I hope you have a blessed day. And if you like this video, please share it, like it, comment. And if I can help anybody at all through these videos, then my job is done. And I thank you for watching, and you have a great day. All right, bye-bye.